Welcome to Inspired to Heal, where I interview innovators, educators, clinicians, and leaders in government-run health institutions. Season 1 focuses on former staff at Cook County Hospital, Chicago's safety net health system. Welcome to Inspired to Heal, where I interview innovators, educators, clinicians, and leaders in government-run health institutions. Season 1 focuses on former staff at Cook County Hospital, Chicago's safety net health system. I'm Bill Trick, your host for Inspired to Heal. Today, our guests are Caryn Stancik and Elizabeth Reidy. Caryn was the Chief Communications Officer for the health system, and Elizabeth was the General Counsel, or lead lawyer, for Cook County Hospital. I'd like to hear about what led you into healthcare, what led you to Cook County, and what sustained you. Caryn, let's start with you.
I was a really sick little kid. I was diagnosed with ulcerative colitis at 7 and had a family of colon cancer. In fact, my father died from colon cancer when I was 9. And so I was in and out of hospitals a lot. I was actually at La Rabida for a stint, and then I landed up over at the old Weiler's Hospital at University of Chicago. Much like families with generations of doctors and lawyers and teachers, I came from a family of public service. And ironically, public service at Cook County Health. My grandmother worked at Oak Forest Hospital in the 70s. We used to take the Cicero Avenue bus and go play bingo with the old folks, have lunch in the cafeteria, and you wouldn't get out of there before you said a prayer in the chapel. And then my mom was a public health nurse at the Cook County Department of Public Health for nearly her entire career. When my dad died, my mom was working public health clinics that were at night. I think it was the first Monday of every month we were at Oak Lawn Community High School doing a mass vaccination clinic. And I was, air quotes, Bill, volunteered to amuse the little kids and distract them from the fear of the needles. And I did that longer than I needed to. There was a certain point where she'd be like, you can stay home by yourself if you want to stay home. I'd be like, no, I got to go see my kids. And so that became just part of my life. When I went to college, I didn't have the stomach to be a doctor or a nurse. And so I studied journalism and marketing. And then when I got out of college, the public information job opened up at the public health department, and it was just kind of a no-brainer for me. This was the public health department, and you get exposed to foodborne illness outbreaks, the AIDS epidemic, the 95 heat wave. I was hooked, but sustain mission, patience, coworkers, and pace. The pace was insane, but I thrived in that environment. Your priority at 11 o'clock in the morning was often a different priority than 2 o'clock that afternoon. But mission and patience first and foremost.
I echo what almost all of your podcast interviewees have said, the patients, the people, the mission. I had such a deep respect for so many of the providers and administrators, and many of whom you've already interviewed. And I was generally in awe of the kindness, the compassion, just the decency they brought to their work and to their patients. We had public service in our family as well. My brother was also a government lawyer working for the U.S. Attorney's Office. My sister was a public school teacher. When I worked for the state's attorneys, I was primarily healthcare. So when Bill Foley, who was the first CEO of the system, came to me and said, do you want the General Counsel's job? For a nanosecond, I thought, gosh, I love these state attorneys. I love this job. I love everything about it. And then I pictured someone saying to me, this is Jane Doe. She's the General Counsel of the health system. And I'd be like, wait, that's my job. So I immediately took the job out there and never looked back.
After joining Cook County, you seem to develop a camaraderie among some of the leaders in the executive team. Could you talk a little about that team and how you viewed your role with the health system?
We had a little team. It was Caryn and I, and then Glady Lopez, who was the head of HR. I used to joke that we were the wind beneath our heroes' wings. I can remember talking to John Barrett back in the day, and he'd call me about some bioethics issue or something. We'd be working something out or some personnel matter. And I turned to him and I go, John, you go save a life. We'll take the paperwork from here. Yeah. Because, we just wanted to be able to make it easier for the people on the front line to get their job done.
John Barrett was a trauma surgeon, but
right.
Just a little bit about him.
He was fabulous. I met John when I was a young assistant state's attorney, and they invited me to be on the bioethics committee. And John headed up the bioethics committee then. And he was, first of all, his Irish accent was so charming. I had to focus, get away from how charming it was and listen to what he was saying. And he was just a delight of a person. He was the chair of trauma at the time. But John was a legend.
I need to tell my John Barrett story now. Reidy Jones had enlisted a couple of us to spend the last night at the old county hospital. So we spent 24 hours. We were on shifts, but it was 24 hours of communication staff staffing the ED and the trauma center at the old hospital for the media. This was a big deal. We were closing this old hospital and moving into this new kind of modern facility. And so I think that might have been literally my first encounter with John Barrett. I was sitting kind of quietly waiting for a reporter and a camera crew to show up. And I heard this big, boisterous Irish brogue. And he might have been one of the loveliest people you'll ever meet in your life. I mean, if you met
Wait a minute. What about David Goldberg? Can't forget David.
No, well, yeah. I said one of. I'll put David in that bucket. Actually, a lot of your guests, Bill, Elizabeth, and I have had a lot of fun kind of talking through some of your shows and not realizing the depth of some of the guests that you've had. We didn't know their life story. Dr. Barrett was that person that you would meet on the street, and if he told you he was a trauma surgeon, you would never have believed it. He was just this remarkably calming force.
Yeah. Yeah, I recently heard Stephen Colbert talking about the Irish sense of humor, and he probably fit well because they said something like, the Irish love being sad, but they like even better to be happy about being sad.
That's good.
So you both worked for many CEOs. Did you ever have a tally? Yeah. Do you know the number?
It's funny you should ask that. When we were talking about and prepping for the podcast, there were a lot of CEOs. I started as an assistant state's attorney because when I decided to do healthcare law, I sent a little snail mail letter to what I thought was the General Counsel of Cook County Hospital. I got a response from the Cook County State's Attorney's Office, who was then acting as lawyers for the hospital. In 1990, when Dick Phelan was president of the county and he brought in Ruth Rothstein, who we could spend a whole podcast on, when he brought in Ruth, they eventually developed the Bureau of Health Systems. We saw a lot of CEOs, but probably the most remarkable prior to the development of the system for us would have been Ruth M. Rothstein, who was a formidable figure. She was smart, she was strategic, she was tough as nails, and genuinely mission-driven. Mm-hmm. You'd walk into Ruth's office and there were photos of her and Golda Meir, Ruth and Princess Diana, Ruth and Harrison Ford, because they filmed The Fugitive there. And I think that might have been her favorite. She had to have breakfast with Harrison Ford. She had a great team around her. Ruth had Pat Terrell, who was her deputy, who was a phenomenal talent. She had Dave Carvalho, who was a really talented lawyer that she brought on board. She was there for I think maybe 14 years or so, was it, Caryn?
Something like that, yeah.
Yeah, something like that. And then after that, we did have a series of them. When we got the health system in 2009, we had a quick series of 2 years, 2 years, 2 years. I worked directly as the general counsel for those three CEOs, and I respected all of them. And from my perspective, each of them were the right CEO for the time. You had Bill Foley as the first CEO in there, and he was an established healthcare executive. He built the team that was going to be the system team. Then the second was Ram Raju. Ram was a very charismatic physician healthcare administrator, and he was from New York's public health system. Ram was a strong advocate of the principle that healthcare is a right and not a privilege. And it was Ram that was there under the Affordable Care Act, so that he, along with many others, including, if you remember, the phenomenal Susan Green and her team, they put together County Care. And that was a huge and important initiative. And then the third CEO, the one I left under, was Jay Shannon. He followed Ram, and Jay was homegrown. And so he knew the system well, he knew the people well. And my observation of Jay was laser focused on the delivery of quality patient care. So yeah, there were a lot of CEOs, but Ruth got the new hospital built. Everybody, I think, put their oar in the water and got us further down the stream.
You've seen all these CEOs. If you could put a composite together, or were there qualities that you say, these are qualities that were very effective? Clearly, Ruth, you have a very fond recollection of her leadership style. And maybe you just say it's Ruth Rothstein.
Yeah, right, exactly. Now, I probably have to stop you there. Fond recollection. Yeah. Ruth was a tiger. I mean, I had a unique situation. When I got out of college, I went to work in public relations. I didn't go to law school straight away. And I found myself at this little hospital called Schwab Rehabilitation Hospital on the west side. I'm working along there. Then all of a sudden they're taken over literally by Mount Sinai Hospital, absorbs them. And I'm a 22-year-old girl who was like the one person public relations department reporting to Ruth Rothstein who would have me for lunch. I mean, I would go into the meetings like the cowardly lion. I do believe in ghosts. She was such a strong force and figure. And I mean, I learned a lot from her, but she was tough. She was really tough. I mean, it was the old story that, 10 minutes early was late for a meeting, and she was just wonderful. But really, to report to her, you had to be on your toes. She was tough.
I also met Ruth when I was 23. When I first started in the county, I started as a public information officer at Public Health. And it was at the very time that President Phelan and Mrs. Rothstein were trying to collapse everything into one thing because there was so much infrastructure and nobody talked to each other. But if you would have told me in 1990 that Ruth would become probably my single largest mentor and a very dear friend at the same time, I don't know that I would have believed you. Her passion for the provision of healthcare to vulnerable communities was unlike anything I think we've ever seen. And the impact she's had on not just my life, but predominantly the lives of all the women in that leadership suite. She taught us how to assert ourselves to get things done that were on behalf of the patients we serve.
I used to say that if they ever make a movie of Ruth's life, and they should, because she was such a really wonderful human and a really dynamic individual, I said at the end of the movie, when they have Ruth Wranglers, I want my name there. It was Terry Conway at one of the tributes to Ruth had said that Ruth didn't get things done, but she had an unbelievably successful way of getting other people to do her bidding. She got things done by making you want to do it for her and get it done right. So she was an interesting leader. I think, they broke the mold there. She was certainly an advocate for women. Caryn's right there. And she would go down to the county board, and she had a seat that didn't have her name on it. But I'm telling you, nobody sat there. And she was always in that seat. And the commissioners were comically, I'm not going to say intimidated by, but respectful of her. The commissioners are the board of commissioners. They're the leaders there. They're calling the shots. They're making the decisions. They're the elected officials. But they would give Ruth her due. And I remember sometimes when they'd be trying to nail her on something, not nail her, but they'd be looking for accountability. And they'd point something out that had gone wrong, because you're running that hospital, running that health system, something's going to go wrong. And they'd be talking about something, and she'd stand up and she'd go, "We screwed up, Commissioner. We screwed up. Is that what you want to hear? That's it." And then everybody would just be like, "Thank you,
Okay.
Ruth." That'd be it.
You spoke about the rapid pace of the health system, the demands of CEOs, particularly Ruth Rothstein. So I've got to ask, was there ever any fun in the C-suite?
Perhaps fun's the wrong word. Did we have a really good relationship with each other, all of us? Each CEO brought a different personality, Bill. All of them had a sense of humor. The executive team or the leadership team, we never really called ourselves the C-suite. We'd say the leadership team. There were a handful of us, Elizabeth probably being the prime candidate, who knew how to bring the temperature down and throw a little levity into the day if it was a high stress situation.
Yeah.
Elizabeth, fun?
Yeah. Yeah. We one of the things that was critical is a sense of humor was so important, because it was a highly charged environment. And many days, given the nature of the institution and the fact it was a large public hospital, we had a lot of crisis du jour. And so there was a lot of tension, and it was nice to have a kind of an esprit de corps and a collegial relationship. I really enjoyed most all of the people. And as Caryn said, we didn't call this C-suite. That's a bit rarefied for us. We were, working hard. And I think it was Bob Weinstein that said that lead from the front and, be seen and doing work. And these leaders all rolled up their sleeves. Everybody was a working executive. You weren't sitting in a corporate office delegating. You were in the trenches together.
During my time there, one of the biggest shocks to Cook County Hospital came with the passage of the Affordable Care Act. Could you speak to how that changed your work and the work of the health system?
Well, Bill, as the health system decided that if it was going to survive in a post-Affordable Care Act world, we had to evolve into something different. We were very much a provider of episodic care. Come into the emergency room, we'd fix you up, and we'd send you on your way. But when Medicaid expansion came in, we knew that if we were going to be able to retain our historic patient base, we had to build a much more comprehensive health system. And so, in addition to building the infrastructure to support what is now the largest Medicaid health plan in Cook County, we also had to build systems that were more than acute care. We needed to build a much stronger primary care system. When I went back to the health system in 2013, it was a $1 billion operation, and it's a $5 billion operation today.
Caryn, you went through quite a transition from working for a health system that took care of people that didn't really have a choice to transitioning to we need our patients to want to come to Cook County Hospital. It must have been a really dramatic change for you.
There's two things I would say to that. The first one is the organization was largely reactive when it came to communications. There's not a lot of public health systems around the country that have large marketing or communications staff. So when I came back in 2013, one of the things that Dr. Raju said to me was, we got to be more proactive. And at the same time, we had gotten the health plan off the ground, and we were trying to build this more comprehensive system so that we could keep our legacy patients, but also attract new patients. We know that police officers and firefighters are always going to choose county if they get shot or if they get burned. The challenge was, how do we leverage this life and death care into convincing folks, if this is where you want to be, if you're shot, this should also be where you want to be for cancer care or diabetes or your hypertension. And so we built our marketing campaigns solely around those kind of areas of specialty that we knew we had a really strong reputation for. We worked for a ton of CEOs over the course of the last 10 years, but all of them were committed to the same thing, which was improving healthcare and continuing our historic mission about vulnerable populations. And they gave us the resources. And that's unheard of. I mean, I can remember getting phone calls from my colleagues around the country, and they'd be like, you're doing ads? Yeah, I mean, we've got to improve our payer mix, right? We're not going to survive in a post-Affordable Care Act world with just Medicaid and self-pay. We've got to improve our payer mix. We spent a lot of time talking to the docs about what were they proud of outside of those kind of big things like trauma and emergency room. And then we had to build credibility with the physicians, because you guys were the ones that had the good patient stories. It was just our job to kind of harvest them from you. But because it was an organization that was so insular and so focused only on reactive media, which for the most part tends to be negative, there was a level of trust that we had to establish with doctors. So I can remember Dr. Fegan bringing me into medical staff meetings to try to build a reputation and build a rapport with the physicians so that we could get the stories out. They were your stories. They weren't my stories. They were just stories of this health system that we never told anybody about. So once we started to tell people about all the research we were doing and all of the medical discovery around infection control and AIDS, we built a reputation. And I really love certain seasons, because when heat waves hit, when flu season comes, COVID, we had established such a good responsive reputation with the Chicago media that they would call us first. And it was a very rare occasion that, because we had built that rapport with the physicians, that we couldn't be immediately responsive to whatever the media call of the day was. And all of that was a very proactive strategy designed to improve the reputation beyond what the legacy patient thought. And the market research that we did all the way up until I left demonstrated that. Joe Q public, Joe Q taxpayer, Joe Q civic leader, everybody felt very strongly that the Cook County Health System was a really important community benefit in this town.
Did you find that people felt that we were trustworthy because of our mission, and that it was easier to engage the media? They recognized we weren't trying to market a new procedure, something that would bring in revenue. This is really what we think is best for public health.
Yeah, absolutely. So the media's interaction with us prior to, I'll say probably like 2012 or 2013, was really either because something had gone wrong. Remember, everything we did was in a fishbowl. So if there was a malpractice settlement at our place, it was public information. If it happened across the street, nobody knew about it. So we had to respond to those types of calls. But when it was something that really did impact the public's health, they knew they could turn to us because we weren't looking to profit off of this.
From evolutionary theory, there are shifts and drifts. And drifts are things that happen slowly over time. Shifts are big disruptive changes. At Cook County Health, I saw things as a medical student in the 1980s. And when I compared what the institution was like in the 1980s and when I left in the 2020s, there was a big change in the way patients were treated and the way care was delivered. There were incredible mission-oriented people who built wonderful programs. But in the past, the customer service wasn't as good as it became. It had improved over time. Do you recognize these improvements in patient care as drifts or shifts? And if it is a shift, what were the big events that made the health system work better?
I would say one of the things in my tenure would have been the establishment of the Independent System Board. Now, I mean, we will say as a given that everything we ever did, the driver was always the patients and quality care. What we were experiencing prior to the development of the system board, every 2 weeks, Ruth would bring a cadre of professionals and physicians down to the county board, and they would sit from 10 in the morning till 5, 6 in the evening, and they would be there along with the sheriff and the court, etc., to get purchases approved, people hired, contracts approved. Well, the very nature of this bureaucratic beast made it difficult to efficiently operate a major public health system. And it was the county board at that time that recognized the need for what they called an independent board, and they passed an ordinance establishing it. When we talked to leadership, it was very clear that they were desperate to be able to hire quickly, they needed to purchase quickly, and they needed to get medical staff appointments done. And those were time-sensitive things that couldn't wait or couldn't get kicked because, of some parliamentary reason that something was moved off an agenda. So they created this board, and the board also, by the ordinance, brought expertise to the board. We had healthcare management, labor, finance, public health. I think that it allowed us at least to move more quickly.
That independent board that you mentioned, a little reluctant to try and explain it because you know exactly what happened, but it went to people who are not politically elected but volunteered. They were nominated and approved.
Right.
And how do you keep such a process from being political? The nomination process, the approval process.
I credit the county board with that because they passed the ordinance. And well, let's not kid ourselves. By statute, the county board is ultimately accountable for the health system. But they chose to delegate a lot of those operations to the system board. Public health agencies in the city were nominating the members to the board. Then the county board basically stepped back and let the system board run it. It was to the credit of the county board that they chose to improve the efficiencies and the expertise by appointing this independent system board. And anybody who knows me at the system knows it's at this point that I do my speech about the little I, because it's an independent board, but I say with a little I because it is a creature of ordinance. So what the Cook County Board put together, the Cook County Board could dissolve.
Ultimately, the buck stops with the county board.
Correct.
We were fortunate for the entirety of my 25 years to have a county board president's office that was always remarkably supportive. They believed in the mission, as did the CEOs that they hired. President Phelan and Ruth together built the political will to build the new hospital. Stroger Hospital was the first new public hospital built in this country in some 25 years. Never were we wanting for a county board president or a county board, for that matter, to be any more supportive. They were driven by the mission of the organization.
Mm-hmm. There are several other urban public health care systems. When you did run into problems and you needed some guidance, which ones did you feel like this one's like Cook County and they can guide us?
There were folks at Grady. There were folks in LA County, New York, but their system's a little bit different and it's significantly larger. But I really think Grady for us was a real close ally in that they had a very similar demographic population. Hennepin County too.
I was going to
Um,
say Hennepin was one that I would have used.
yeah.
I would talk to those folks. And, also, Bill, it was a small world. I remember one time when the system board was recruiting a CEO. At the same time, Dade County was doing a search at a similar time. And I remember Ram Raju came into his interview with the Dade County pen. I was like, gee, I wonder if he interviewed Dade. It was just, so when we interviewed, we'd see the person from Denver and the person from Maricopa would interview with us.
Right. Each CEO has their own level of risk tolerance. In your experience, how important were you as the General Counsel in establishing that level of risk tolerance for a CEO?
I guess I'm sure that depends on the personalities involved. It's my opinion as a general matter, it's the lawyer's job to basically advise the client of the risks, help them assess the risks, but then absent some apparent illegal conduct, the client makes the business decision. And there may be times that the client will say, well, what would you do? And then you can weigh in. But other than that, I remember Ruth would turn to me and say, I hear you, Elizabeth. I hear you're saying A, B, C. We're going to do D. Are we okay? And I'd say, it is permissible. You can do D. Mm-hmm. So, and she would basically take the risk. Now, you wouldn't let somebody completely out of the box and wear it recklessly. You would raise a red flag. But in general, you advise them and they make the decisions. And my thought was to try and to help people think outside the box. If they came to you, like a department chair would come and they'd say, I want to do this. And you'd recognize that the way they were presenting to do it couldn't be done. Rather than just say, no, that's wrong, you would try and think outside the box, find a way that they could do it, which would be permissible. And 9 out of 10 times you could do that. I did not like to think of the General Counsel's office. I did not want to think of them as a roadblock or a hall monitor, but rather when someone had a problem, I didn't want them to avoid the General Counsel's office. I wanted them to seek us out as a resource to help them figure out the right way to get things done within the confines of whatever policy or law they were wrestling with. So I always wanted someone to think, well, let's go ask, Elizabeth or Helen Haynes or Randy Johnson or Jessica Pipersberg, all the great people that I had the privilege to work with. They'll help us get this done. Not, oh, don't tell them because, they'll put a roadblock up. That was my experience, and it worked out very well. I think in general, people knocked on our door.
Mm-hmm. Yeah, and Bill, it goes beyond the CEO and the medical staff. The rest of the leadership team would often go to Elizabeth and the legal team before we'd go to the CEO with an idea. We'd go and say, okay, here's what we're thinking. Can we do this? She would say, yes, you can do it that way, but let's look at it from another way. The credibility that the legal team at the health system had was incredibly high. And that, my friend, is a testament to you.
Thank you. And my partners, who I mentioned, we were real lucky, and everybody
it was a great team.
Yeah, it was a great team and mission oriented. I used to worry that Helen Haynes was getting sick over losing sleep over the mission. Yeah. She was incredibly dedicated.
If both of you could go back in time and advise yourself, your past self, on, let's say, day one of your employment in Cook County, what advice would you give yourself?
That's a fun question. And what I would probably give myself the advice that I gave all the new assistant state's attorneys that I saw over the years and all of the people that came through the General Counsel's office. And for me, that was simply keep your eye on the legal ball. Don't get distracted by who the players are, whether it's a powerful elected official or somebody who's, really pulling heartstrings on an issue. Your initial job is to keep your eye on the legal ball, give these folks the best legal advice you can, and then stand by to assist them in finding the best response within the legal parameters for that job. So that would probably be it. Keep your eye on the legal ball.
Yeah, mine is a slightly similar spin on that. I was young when I started at the county, and so I was kind of a people pleaser. I wanted everybody to be happy. But it was when I learned that if I focused entirely on the patient, kind of the noise would drown itself out. If it was right for the patient, the other stakeholders would eventually come around and understand that.
All that support that you provided was essential for the health system. So coming to my final question, if you could put one item into your health bag, literal or figurative, what would it be? Caryn, let's start with you.
It is a literal rearview mirror. We were all fortunate to be part of this historic organization that has a national and international reputation. But I don't think we take enough time to celebrate the successes we had. I can list 50 things that I'm incredibly proud of, from reopening Provident Hospital to the Core Center to the new hospital to finally demolishing Fantis, the new clinics, the administration building. There were all kinds of tangible things that happened in this larger urban environment when public health systems and other systems were downsizing or closing all out. We built this giant Medicaid managed care health plan, bigger than all the commercial plans, with far less resources. Cook County Health focused on health equity when nobody else was talking about health equity. And the one thing that I don't think we talk enough about, the care that we provide at the jail is remarkable, comprehensive care to a population that people often want to forget about. You guys trained thousands of doctors and nurses. The research that you were involved with, Bill, right? And, things like food and housing insecurity, transportation needs. We were part of all of that, but yet I don't think we take the time to look back and think, boy, have we gone a long way, because we're always focused on what more can we do for the patient population that we serve. I'm immensely proud of what I was part of. And I'm glad that there was a foundation built for us and that we built a foundation and left that for the next group. So rear view mirror for me.
For me, what I would put in the bag is something that it's a quality that I used to refer to when we would do an interview at the system, whether it was interviewing someone for the General Counsel's office or looking for a CEO or anybody that you might be interviewing. And that's a term that I used to call county coping skills. From a quality perspective, Cook County can compete with the richest hospitals in the world, quality first. They've got that down. But from the employee's perspective, a public hospital is kind of a no-frills environment. There's not a lot of material perks, and you're often required to wear many hats. So county coping skills is the kind of thing that you know it when you see it. And I could usually tell pretty quickly in an interview whether a candidate had what I thought was the necessary county coping skills. It's a kind of a combination of grit, resilience, low maintenance, and a willingness to pitch in and work. And I thought that would allow you to thrive in a public hospital setting. You couldn't be a delicate flower and someone who had a lot of expectations and frilly needs. You had to be able to take what you had and make the most of it. So I'd say county coping skills.
Thank you. Before this, I asked someone, do you have any stories that you could tell me about them? And they said, nothing I can tell you. There are plenty of stories, but nothing I can say.
Well, you should know, Bill, that in preparing for this, Caryn and I said, boy, we can't be as funny as we'd like to be because there's so many great stories, all ultimately positive and complimentary. But, as General Counsel, I can only speak in generalities. I said to Caryn, if he says, can you give me a specific example? I can't because of, attorney-client privilege. But yeah, that's pretty funny. Not that I can tell you.
I appreciate you taking the time.
It was our pleasure, Bill. Thanks for asking.
Bill. Take care.
After interviewing Caryn and Elizabeth, I spoke to their good friend and the former Chief of Human Resources, Glady Lopez. And Gladys had this to say.
Our focus was always take care of our employees, and the employees will take care of our patients. And I remember Elizabeth would always say to the doctors, you go save lives and we'll take care of the paperwork. As I thought back over the years, I thought, well, what can I share that Elizabeth would be okay with me sharing? And I think one of the things that I thought back on, Bill, was, if you'll recall, every month there was a board meeting. And in advance of those, we held prep sessions. And in these meetings, what really stood out to me was watching Caryn and Elizabeth get to the heart of what we needed to communicate so we can educate the audience that was there, support our leaders, but more importantly, continue to get what we needed at the health system. One story that I can share that I remember is we're in the midst of Joint Commission. I received a call from downtown Cook County. They were asking for a boatload of information and data. Elizabeth was in my office. She puts the call on silent. She looks at me and she says, smile as we respond. They don't know that we're working on our future with these next few days. So we got it back on the phone and I said, thank you so much for your inquiry. If you can give me some time, we're currently in joint commission. I was trying to be as professional and calm as I could during a very tense call. When they said, okay, yes, get back to us, but as soon as you can, we hung up the phone and Elizabeth picked up my water bottle and she looked at me and she said, the award goes to Glady Lopez for maintaining your composure. So it was little things like that just really would keep me going. Watching Caryn and Elizabeth was inspiring because they tackled challenges with grit and heart and an eye roll that only I could catch across the room. To Caryn and Elizabeth, my partners in crisis and co-conspirators in joy, I just want to say thank you for showing me the best side effect of work is a true and genuine friendship, and for being there to support me and the rest of our leaders when we were at county.
Many thanks to our guests for sharing their words, but more importantly, their acts of service. Please email us your inspiring governmental healthcare or public health stories at info@inspiredtoheal.net. Thank you for listening.
Inspired to Heal podcasts are for informational purposes only and should not be considered as health or professional advice. We are not responsible for any losses, damages, or liabilities that may arise from the use of this podcast. The views expressed do not necessarily represent those of the host or the guest's current or past employers.